Assalamu alaikum and a very warm welcome to Natural Health on Deen TV with me, Dr. Fatima Paruk. We hope that you will join us here each week on Natural Health so that we're able to familiarize you, our viewers, with the expanding world of alternative and preventative health by introducing you to a diversity of different therapies and practitioners, as well as health-related topics from a natural health point of view. We hope to keep you abreast of the many natural health therapies that are currently available here in South Africa, their individual benefits, and how they can be used effectively for specific health-related conditions. In keeping with our theme of mind and body in health, my guest today is Mr. John Dutton, who is internationally recognized for his workings and research in hypnosis. He's an author and an accredited facilitator, as well as the principal of the South African Modern Hypnosis Society. Welcome, John, and thanks for joining us here on Natural Health.
Thank you for having me.
Tell us a little about yourself and how long you've been in this field.
Well, I've been blessed to be involved in hypnosis for over 20 years now, and I've worked on close to 10,000 people. So it's been quite a journey for me, and I've been able to work in most areas that hypnosis is used in, and yeah, it's been a blessing.
For those people that aren't very familiar, what exactly is hypnotherapy?
To answer that question, I want to take you back to where it actually comes from so they'll understand what hypnosis really is. It actually comes from Africa, from Egypt. Some 2,000 years ago, there were depictions that priests were using altered state of mind or a relaxed state of mind to help people heal. And it actually comes from there, and that's basically what it is. It's getting the mind and body to work as a unit.
So how do we then use hypnosis to treat health-related conditions?
I think it's very interesting to note that every health issue we have is related to the mind and the body not working together. So if we can get them to work together as a unit, naturally, we are on a very good pathway to healing.
So you've been in this for a while. In practice, what are the most common health-related conditions that work effectively when you use hypnosis as a therapy?
It's quite amazing. Myself and my practitioners throughout our country and overseas, we are really working with all sorts of issues, from stopping people smoking to healthy eating to sleep disorders. We're helping people with diabetes right through to anxiety, stress and depression and pain control. So there are many areas that this tool can actually successfully be used in.
Okay, give us a little more insight maybe on the link between the mind and the body in terms of health, in terms of treatment.
I think the easiest way to explain it to your viewers is if we look at a computer, we have a screen, we have a keyboard, we have a mouse, and we have the program inside the computer. Now, if you want that computer to work differently, buying a new screen or changing the mouse is not going to change the way it works. And the subconscious mind is our computer program. So we need to go to the subconscious to change behaviors and correct them. Okay,
just enlighten me a little bit. This is a very interesting field, although some people might tend to be a little nervous about it. What can one expect in their first session of hypnotherapy?
Yes, a lot of that anxiety comes from stage shows and the myths of hypnosis. What they can expect with a trained professional is to have a proper interview before going ahead with treatment and making on the decision what hypnosis actually can do for them and can't do for them. What they can expect is a very pleasant experience, not like going to a dentist or where you're going to experience pain and things that might stress you. It's very relaxing, it's very natural, and most of our clients, once leaving, can't wait to come back for more.
Okay, the thing that personally for me is quite alarming, and I think most viewers will be able to relate to this, is when we come in for a session of hypnotherapy, are we very much just an open book that a therapist can just explore, or are we still in control of the process? What happens?
Yes, that's a very good question. The fact is that all hypnosis is self-hypnosis. Your practitioner knows the techniques and how to guide you to the right techniques, but we actually do it to ourselves. If you've ever daydreamed, you've been in hypnosis. So it really is not the practitioner controlling you, it's the practitioner giving you skills to control yourself.
You did mention things like anxiety disorders, panic attacks, depression. How many sessions of hypnotherapy can one expect to have before you see some kind of improvement?
That's also a good question. A lot of people in this world are looking for quick fixes. Hypnosis can respond very quickly or take time. What we do know from science is that a behavior, human behavior, can change within 14 to 21 days. So we have that timeline to guide us to how many sessions. Some people may need 2 or 3, some people may need more, but we have a clear indication after about 3 weeks of working with them.
3 weeks coming in each day, or each week, or every couple of days?
No, we work with them and then we give them self-help work to do by themselves at home on themselves. And once they come back, we can assess what they've achieved during that period of time.
Okay, so talk us through what goes on in a typical session.
Okay, a typical session, you would be obviously filling in your documentation, coming through to the therapist, and you would sit down and have a good chat first. Just clearing up the myths, the fears, anxieties, and really getting to the nitty-gritty of what you want to achieve by working with your hypnosis practitioner. Once that's clear, then we can go ahead and you can enjoy the session, and basically after working with that client, they would be briefed, they would be given things to take home with them to do and to motivate them moving forward until the next visit.
Okay, a very important question that most people would want the answer for. Are there any adverse effects from hypnotherapy?
It's really strange, that question comes up a lot, but it's a natural process. We do it to ourselves, our brain and our body work together to do this. The actual process of hypnosis is totally natural. There are no side effects, there's no addictions to it. As long as you're in the hands of a trained practitioner, the process has no side effects whatsoever.
And all trained practitioners do have a certain qualification here in South Africa?
Yes, our practitioners all have a strict code of ethics that they work under, and obviously there is control of what they do, and they have to reach certain levels of training to go ahead and work in areas that are advanced.
Okay, how has this profession grown in the last 10 years, would you say?
It's been amazing, having been around for 20 years in it, to see the changes of people's ideas and thoughts, and that they are looking for alternative ways of helping themselves now. They are uncovering the myths of hypnosis, that it is not just a stage show or somebody controlling you, and the awareness of neuroscience is coming through. So it really has grown dramatically. We need more and more practitioners professionally to work out there.
Because obviously, I mean, from my own personal experience, we didn't hear much about hypnosis in the past, and now it's coming up ever so often in conversation, in therapy, in forums. Where do you see it going in the next 10 years?
I believe we've only just touched the tip of the iceberg here. The growth in people learning how to use it, how to work with it, and all the proof coming through the research that myself and many people worldwide are doing, showing the results we're achieving, I believe it's only just begun.
Are there any patients that don't succumb to hypnotherapy, or is everyone susceptible?
I think it's really good to enlighten your viewers about this, because it really, first of all, the person needs to want to be helped by the practitioner. If they're dragged along there and they're not willing to be helped, and it's very difficult for a practitioner to work with hypnosis. As soon as they want help, we have a really big winning factor. I think the other thing is to realize that we actually all hypnotize ourselves by daydreaming and doing things that are very natural. It's natural. One of the biggest misconceptions is you have to go under hypnosis. Now, you go underwater when you dive, and you go under anesthetic when you have anesthetic, but you don't with hypnosis. You actually cycle the brain down slowly and go into a nice, relaxed state of mind. Some people do very quickly, some people do very slowly. The bottom line is that you're going to find that we all are able to work with this. The only people we cannot work with are people who can't hear us and people who have brain retardation. And those, apart from that, everybody else has a level of working with it.
What about infants and children? I mean, are adults only susceptible to this because of their level of control, or are kids also as susceptible to hypnotherapy?
It's really so sad that more children are not helped through hypnosis. We have some really good practitioners throughout our country working with children. The age group 6 to 12 are what we call highly susceptible to the process. Their response time is hugely better than those of adults, and a child can actually use these tools for stress, anxieties, for anything they need to help them with their studies, and be very, very effective in a short period of time.
Okay, I'm going to try and run through a few conditions for me, and maybe you can just help me work through this, because I've heard that hypnotherapy is very successful for particular conditions. Let's talk a little about IBS, which is irritable bowel syndrome.
Yes. Again, the trigger of stress and anxiety is where it all comes from if you really track it down. And I would say 80% of my clientele that come to see me are suffering from some form of anxiety or stress. And we've had amazing results in working with people who have IBS, and suddenly it disappears. So it really is linked. Anything linked to stress and anxiety, hypnosis has a great chance of assisting.
And what does the hypnosis do? Does it calm the people down? Does it teach them how to manage their stress levels, and that's why they're having benefits in health?
Okay. Basically, as we're talking to each other now, in front of your viewers, our brains are cycling at about 25 cycles per second, like a bicycle wheel turning. Now, when we go to sleep at night, it's supposed to cycle down to 9 cycles, 7 cycles, but due to life, due to pressure, to the world that we live in, we don't sleep properly. Our brains are cycling at high levels the whole time. We're eating the wrong foods and pressure of life. So it really doesn't get a chance to rest. Your immune system, your body and mind don't get rest time. Through hypnosis, we can actually introduce rest to the brain and the body, which is phenomenally beneficial.
And that then helps with the actual physical condition that's affecting the patient. And in terms of irritable bowel, it's usually stress related.
Very much so. And if we reduce the stress levels and the tired mind in that person, we see the results coming through very, very quickly.
Okay, what about memory loss? People seem to suffer more and more from memory loss. Obviously, it's not very measurable, so it's a bit of a gray area.
Yes.
But can they be helped with hypnosis?
Okay. Again, our big culprits, stress and anxiety and pressure of life. What have I done with my car keys? I can't find this, I can't find that, and we think something's wrong with us. It's a side effect of a tired mind and the stresses and anxieties. And when people start to do self-hypnosis on themselves and are guided to do that and have processes to work with it, that tired mind starts to go. I work with professional soccer players, sports people, cricketers, and the ability to focus is affected by the tiredness of the mind. So my job is to get that mind untired, and the results are phenomenal on the health perspective as well.
Something like Alzheimer's is mostly, or should we say largely, familial. Is there a way to deal with that for patients that do have a history of Alzheimer's in their family and want to maybe strengthen their mind and try and prevent it from taking over their life at a young age?
Alzheimer's, as we all know, is a terrible affliction to have. I've worked with many people over the years with this. Where we play a large role, a big role, is helping them with the anxieties, the fears. They know that there's something going wrong. They know that things are happening to them. And if we can reduce their anxiety levels and reduce those stresses, we actually give them a better lifestyle. A case that comes to note, I worked with a lady who sadly passed on through it, but she remembered who I was right up to the last stages. She forgot who her husband was, who her children were, but she would know who John was. That is because I was working with her subconscious mind and enabling it to be relaxed in that state. So there's a lot of work to be done in that field.
And as a preventative for Alzheimer's, prophylactic therapy, does it help to delay the onset of Alzheimer's?
If you delay stress, anxiety, and what happens in that subconscious mind, your body's chemistry can produce the anti-fear chemistry, the things that need to go through the system. So most definitely, if you can allow these people to work with that, it's going to improve their chances of fighting back and living a better lifestyle.
And sometimes maybe prevent it entirely.
Amazing results I've seen over the years and through my practitioners as well.
Okay, jumping to a few other health-related topics. People that need a lifestyle change, want to become healthier, maybe have a little weight loss, eat the right kind of foods, people even maybe that chronic smokers want to give up smoking. Is there help for them in hypnotherapy? Most
definitely. In fact, one of the most successful areas of hypnosis and worldwide is smoke cessation therapy, as it's known now, stopping people smoking. The big thing to remember is you can go to a motivational speaker and walk out of there and you want to change your life, you want to change the world, but 3 days back in normal life, that motivation is lost. It's because your conscious mind has taken in the information. We give the subconscious, the program of your mind, the information. So when you go on a diet and you lose weight, as soon as you stop the diet, you go back to your bad eating habits. With this, it's a behavioral change. It's a lifestyle change which carries on. That's why it's so effective.
So are patients then programmed to make healthier choices, or do you enable them to change their mindset so that going forward they are able to, effectively change their action to bring about those changes in their lifestyle?
What they are actually doing is making the changes come about. Obviously, in our interviews with them, we find out what they want to achieve, where they're having difficulty, and we turn that around to a positive behavior. but they're actually changing their behaviors within themselves to a very healthy way of living. And it's quite phenomenal how people, the side effect of having weight around starts to disappear naturally when you start to live healthily, and the mind and body working together are very, very powerful.
I always tend to think that weight loss is a side effect of choosing for choosing a healthy lifestyle.
Yes.
And it shouldn't actually be a choice, just weight loss, because as you said, it doesn't actually last. So choose a healthier lifestyle, make that change in your mind, and everything kind of falls in place after that. Hey?
I agree with you. The mind and the body together know what weight you should be. They know what you should be eating. They know what is needed to make you healthy, how much exercise. Allow them to do it together, and you'll see the results are phenomenal. We have a huge problem with obesity in South Africa, and we are working with children 7 years old at the moment for obesity. And it really does help to change their behavioral patterns around food, exercise, and healthy living.
Okay, another topic that's also quite interesting, pain control. How can hypnosis help with pain control? And can you give us examples of things that it can help with in helping viewers in their daily lifestyle to control pain, maybe reduce the amount of painkillers that they take?
I'm going to give you some really accurate sort of levels of research that I've done. I've been blessed to work on 3 patients who could not have anesthetic during operations, and they were able to use hypnosis to get through it without medication, without pain control, quite successfully. But they only 10% of the population can do that. But research shows us that 80% of the population can gain some form of pain relief through working with hypnosis, through to childbirth, through to cancer. So it definitely is a process that helps with pain.
Give us an example. I know you mentioned a little earlier that you had someone have their teeth removed without any anesthetic.
Yes. Now this lady wasn't allowed to have any form of anesthetic because it would endanger her life. Having worked with her and prepared her, she was, fortunately for her, in the highly susceptible category. She was still aware that the nurses are there, the dentist is talking to her, she knows that I'm there. It's not an anesthetic. So by her focusing her mind away from the pain centers and the receptors, she was able to be on a picnic with her friends in her mind and chatting to me about the clouds and the rain while the doctor was doing his work. So it really is, that mind is so powerful for distracting itself away from pain.
And she didn't feel a thing?
Happy, big smiles, and so proud of herself. And by the way, there's a far less bleeding during the process as well, which was noticed by the practitioners. And it's not only me, it's been done many times, but that type of thing, again, I must say, is about 10% of the population. But remember, 80% can have some form of pain relief from working with hypnosis. You
said she's in the category that's a little more receptive to hypnosis. Yes. How do you define those categories?
We have certain tests that we do. Practitioners are trained to do susceptibility tests. Mm-hmm. But really it's about the techniques we use. For that type of thing, we need high susceptibility. But for all other areas, we would apply techniques to your susceptibility level to make sure that you get the most benefit. Interesting, people who work with a practitioner and they bond with them, their susceptibility levels improve rapidly.
Over time? Over
time, working with the actual recordings and the practitioner.
Practically, what do susceptibility levels mean? A low susceptible person, a medium, in the medium range, and the higher range. Practically, for viewers to understand, okay, what exactly does that mean?
Let me explain why I said children 6 to 12 are highly susceptible. If we thought about trees, we thought about a pine tree or a Christmas tree, so they say, it really is in that form or shape. Now, at the bottom is the subconscious mind. So when a suggestion gets delivered to that child, there's no branches for it to bounce off. It slides straight through and goes into the subconscious, changes the program, and they behave in that way. Adults are a different cup of tea. If you look at an oak tree with all the different branches, when a change is meant to take place, it will be stopped by all the branches on the way down. So in the adults, there's a lot of resistance to that change, but eventually it gets through to the bottom and change occurs.
John, for viewers that want to get hold of a hypnosis practitioner in their area, what do they do? Where can they get more information on hypnotherapy? And maybe you can tell us a little bit about the South African Academy for Hypnosis.
Yes, SAMA, the South African Academy, we're very proud. We have over 900 trained students, and sadly some of them are practicing internationally overseas, and we are respected worldwide. I think South Africans must not doubt that we have professionals in this country that can compete with anybody in the world and are dedicated to what they do. And I'm proud to have trained a lot of those over the years. But we will, from a SAMR perspective, we can give you practitioners in your area. We have them in most areas in South Africa by just dropping us an email at South African Modern Hypnosis Academy or phoning us, and the details I'm sure that you'll deliver to them. And I think, as I say, we are very, very proud that we have the level of practitioner. I was invited to the World Conference in Australia to talk, so some of my other practitioners have received awards overseas. It's really something to be proud of, but we need to grow more and give more people opportunity to experience the benefits of hypnosis.
Thank you, John, for joining us today and for enlightening us on the role of hypnosis in healthcare. We do look forward to seeing you again on our show. That's it for us today on Natural Health. We look forward to hearing from you. Please do drop us an email on the email that appears on your screen and have your natural health questions answered. Until next week, that's it from us here on Natural Health with me, Dr. Fatima Paruk. Stay well.